Welcome back to the Gee Ursula Show. This hour of our show is brought to you by Guardian Roofing and Pest Control. If you are a first responder, you're used to people in distress calling 911 for help. But just a couple of weeks ago, Seattle Fire Lieutenant Tony Micelli was the one dialing 911. He had tested positive for COVID a few days earlier and was having a hard time breathing. Thankfully, he survived and is now sharing his story. And Lieutenant Miceli joins us now. Good morning.
Good morning.
Bring us back to that day on August 25th and you making that call. What was happening? What were you feeling at that moment?
Well, I was informed that I had the coronavirus on the Friday, so that would have been the 20th. And really, I had been on duty the Thursday, the 19th, kind of felt off. I think it's important that I tell you about this before the actual day I called 911 because it'll paint a better picture for people to be able to understand how this thing, how it progressed in me.
Absolutely.
I felt off on duty, but it was very short. When I say short, I would say an hour or less. And it caught my attention, and I can't describe it other than it was very off. And it passed. Why, how, no idea. I think we had a few runs that night. I woke up Friday morning, and I felt fine. And then as I was driving home from work, that feeling came on again. And I was like, okay, wow. Well, you know what? Maybe I'll go get tested. And sure enough, when I got tested, I found out very quickly I had it. It's important to note, and it wasn't broadcast on the television, my ex-wife also went out and got a test, and she tested positive, but she had been vaccinated as of May or June. Not to minimize her symptoms, they were difficult in their own way, but they didn't require hospitalization and near death, right? And we're glad for that. So either way, Saturday I felt fine. I was doing the quarantine thing. Sunday I felt fine doing the quarantine thing. Monday I was like, I want to get something done here at my house, so I started working in the yard lightly. And then from that point forward, it was just this progressive decline. By Wednesday, and I live, by myself, it really, really, really hit me. And by about 6, I think it was, I called a firehouse that I know had medics in it in the Seattle Fire Department, talked to a couple of the medics that I've known for, almost 25 years, right, or 22 years, rather. And they said, you sound sick. You need to get into the emergency department. And I said, well, I can't drive. And they said, well, you got to call 911. And so I did that. And the Everett Fire Department showed, and I was certainly sick. In the emergency services, at least in King County Medic 1, we use this sick, not sick scale, which would be way too complicated for me to explain. But I heard them say, this dude is sick. And from there, it was just this odyssey.
What? First of all, I'm glad you're here, sir. So I want to say that clear.
Glad to be here.
Why in the beginning did you not want to get the vaccine?
I asked myself that a lot. I was operating from a position where I think I allowed a lot of what I guess I would just best describe it as a large background noise. I am one thing that has been unchanged is it doesn't set well with me a mandate, but I've moved on from that. I see it as two totally separate issues. There's this notion of a mandate. People don't want to be told what they're going to do from an entity like the government, and I can understand that. But I kind of see that as a separate issue, and I hope my message is focused on assisting others to maybe see that as a separate issue. It's not that it's unimportant. It's very important. But in the meantime, it was illustrated to me through personal experience that, I fared the way that I did because I made a choice to not take the preventative measure that has demonstrated to really assist in keeping people out of the emergency department and hospital setting. And that's, that is what my experience was on it.
Lieutenant Micelli?
I lost sight of the benefit. I lost sight of what the benefits are, despite the controversy. There is still very clear benefit to the vaccination. Where on the balanced weight scale of benefit versus risk, I don't know. I nearly lost my life, so I'm certainly hedged towards the benefit side of things of that balanced weight scale versus the potential side effects of it. And I think that would be normal for anybody, or I'd hope would be normal for anybody who nearly died from it.
Yeah, and I want to talk about that. You are 46 years old. You've worked for the Seattle Fire Department for 22 years. Because so often when we share these stories, people say, well, they had an underlying condition, or they, weren't taking care of themselves. But you sound like that was not your profile.
Well, what's interesting is you see, you go through this process, and I think, and you brought up something that I've really seen very clearly. I would have billed myself, and still do, as a healthy person, but I would have we'll go kind of like caveman mentality. If somebody would have said to me, well, what are you basing your general health assessment on? I would have said, well, I'm not being followed by a doctor for disease. I get an annual physical. I don't take prescription medicines. I'm height weight proportionate, and I work 7 days a week like a bull, nearly 100 hours a week for the last 2 decades, unstopped. Wow. I don't have a strong family history of disease. I'm a healthy person. That's true, but what I didn't consider is all the other things that really define health. Good nutrition. I'm not a fast food person, but you eat one meal a day at 9 o'clock at night. That's not a healthy nutrition. Blood chemistry-wise, sure, my cholesterol is acceptable, but is it at peak? Is my physical condition at peak? And the answer to those things were no. So I had kind of a missed understanding of assessment of my health. And I'm afraid some people are making that same mistake. Because they can walk, because they don't have pain, because they don't take prescription medicines, suddenly they're the definition of health. And I think that this thing is so complicated that it requires peak health as best as you can. Certainly not avoiding the toxins of life, the cigarette smoking, the alcohol, et cetera, and the vaccination.
You guys are listening to
kind of where I'm learned.
You guys are listening to the voice of Tony Micelli. Tony Micelli, he works on Engine 9 at Fire Station 9 out there in Fremont, and he is someone who almost died, and he joins the Gee Ursula Show. We got a couple more questions for you.
Sure.
And this is what's really important to me. What can Ursula and I do better? Like, we believe that we want to all get through this pandemic. We all want people to be healthy and live. But it seems like sometimes it feels like we are trying to tell people what to do and get in your business. But the truth is, we just want people to live. What can we do better to make people comfortable and understand, to get on the right side of science? What can we do better?
Did you say get on the right side of what? I missed what you said.
Get on the right side of COVID, of science, of COVID. Like, what is going to help? Because it's all of these different things now that you can do, and the vaccine doesn't work. And I agree with what you said about the mandate. You said that's your thing. But what can we do better to get a better message across so people can adhere to it?
Yeah. I want to clarify something if I can. The mandate is not my thing. I'm still unsettled by it and don't like it. What's my thing is to encourage people. I mean, I was operating in this dimension that had me not listening, I guess, and maybe perhaps have patience for people. They have a strong conviction in their thoughts, as I was. And that's particularly in emergency services. I'll speak about that. Type A personality. What makes successful firemen, in my opinion, after 22 years, is hard-charging, dynamic, ability to adapt, leadership. These are all traits of Type A personalities. Other types of personalities, I'm not an expert on personalities, but I know Type A because I am one. Those are traits. But what comes with those traits, unintended consequence, if you will, is the notion of, yes, I'm a strong leader. I make my own decisions. Don't be pushing me to make those decisions for me. And I get that. What I would ask people to do is perhaps pause. It's the best way I can describe it. Remove yourself from the debate club and neighbors and friends. Maybe step away for a couple of days. Don't think about it. And focus on prevention. In the fire service, my job as a company officer is risk management. That's what I do. It's one of my jobs. Looking at a situation and saying, okay, we're here to help. We're going to fix this problem. We need to manage. We need to identify what needs to be done. We need to identify barriers at which are going to prevent us from doing that, i.e. risk, and manage that risk while at the same time performing the duties at hand. That's one of my jobs as a company officer. I never applied that same philosophy to my own health in this regards to coronavirus. The vaccination is a tool. It is a viable tool, scientifically proven. Is there unknown side effects of it in the future? That's the that's the bum thing about the future. Last time I checked, nobody has a crystal ball. But balancing the clear and present risk as we face it today, right now, that risk-benefit is the risk is definitely there.
Lieutenant Micelli, just
not having the tool.
Yeah. I just want to make sure. Yeah, absolutely, it does. And I don't mean to interrupt, but I just want to make sure that we get this in because it got really bad for you. In the 1 minute that we have, could you describe how bad it got? Because now you're trying to encourage people to get the vaccine, and specifically fellow firefighters to get vaccinated. Right. How bad did it get? When my
first taste of I knew it was bad was obviously calling 911 on my own behalf. Never done that before. But truly it was when I was in the emergency department. After they assessed me, I got a chest x-ray. The physician came in with a packet of advanced directives. I looked at him, and I said, very clearly, I remember, are we there yet? And he goes, unfortunately, maybe. I need to know what you want to do. That's a big deal. I have 3 daughters. Whoa. I have responsibilities. I have an ex-wife. I mean, come on. I have life to live. Advanced directives at 46? Big deal. Yeah. And then so that's the psychological side of it. The physical side of it is you can't breathe. You can't breathe. And it's terrifying. I've seen it thousands of times on emergencies. People can't breathe. I now know what that means. I mean, not being able to breathe from catching some smoke at a fire, any fireman has experienced that. That's temporary, and that passes in a minute or two. This, you can't breathe, and it lasts for days.
Lieutenant Tony Miceli, we thank you so much. We are so happy that you are doing well and that you were well enough to share your story, and we cannot thank you enough, really.
And I want to plug the Everett Fire Department, stand-up fire department, just like the Seattle Fire Department. They're stand-up folks, and they took good care of me in Everett, Providence. Fantastic care.
Absolutely. They've saved my dad, too. Okay, appreciate you. Thank you so much.
Still ahead. It's time for